So once again, Kim, thank you so much for joining us today. We know you're pretty busy, but we surely appreciate your time. Because don't
My
worry, this
pleasure.
yes. So this will be just short, informal conversation. There are no right or wrong answers, Kim. We just want to
Okay.
capture your real experience with DocVA. So, uh, to start with, just please introduce yourself by sharing your full name, your role, the type of
Mhm.
practice or specialty you're in, and your location.
Sure. My name is Kim Inman. I'm a psychiatric mental health nurse practitioner. I own my own private practice. It's a rather small private practice. It's just myself and one other nurse practitioner, but we certainly stay very busy. And we're located in Colorado Springs, Colorado.
Perfect. Thank you so much, Kim. So before working with DocVA, what challenges or pain points were you experiencing in your practice or operations?
We had a lot of challenges. Not only were we doing all of the patient care ourselves, but we were also handling all of the admin work ourselves. So, in between patients, we were trying to answer phones. We were missing so many phone calls. We were doing our own prior authorizations. We were handling any paperwork that came through, basically trying to be clinical and admin at the same time, which just wasn't working out. We were working, long 15, 16-hour days, completely exhausted, completely burnt out.
Wow. And with those challenges in your practice and operations, how is your dog VA, you know, help address those challenges? And what improvements have you noticed since bringing her on?
Oh, she's wonderful. Um, our days are so much easier. She handles all of our admin tasks. We have gotten patients that we otherwise would have missed due to missed phone calls. She's able to, keep an eye on our email inboxes for us. She's able to handle all of the scheduling. She's able to help with insurance. She's able to help with prior authorizations. And she also knows her limitations, which is really important. If something clinical comes up, she knows when she needs to come back to us and be like, hey, I need your assistance with this, which I think is a really important skill to have as well.
Absolutely, I agree, Kim. Especially, we have to always comply with HIPAA. So thank you
Mhm.
for sharing that. So you mentioned about those general tasks, but can you provide the specific responsibilities your virtual assistant is handling in your practice or business operations today?
Oh, sure. She basically acts as both like a front desk receptionist. So she does all of like what a traditional front desk person would do. She answers phones, she helps with patient questions. And then she also does kind of the back end administrative task as well. So insurance verifications, prior authorizations for medications or services. She helps me write, letters for disability services, emotional support animals, um, basically anything that I need help with, she is able to help me with. I don't think there's ever been a task that she has said no to. If there's anything I've ever asked her to do that she doesn't know how to do, she says, show me how to do it. And then she's happy to do it again once I've trained her on it.
Wow, I'm happy to hear all of these things from you, Kim. So, why would you recommend DocVA to your colleagues or to your peers?
It's such a great service. Especially with I do a lot of telehealth. It's very rare that I have an actual in-person patient. Over 90% of my patients are telehealth patients. So I don't actually have great need for a physical person sitting in my front office. When I did have that, it just wasn't necessary. It was almost a waste of my resources to have that person there. And with DocVA, I'm able to have the services that I need. in a much more efficient manner. I love that she's there when I need her, and then just so much more convenient, so much more helpful for the practice.
Wonderful. Thank you so much, Kim. And thank you for sharing your experience, and your feedback would definitely help other practices really make informed decisions, Kim. And we truly, truly appreciate your partnership.
Thank you.